So, okay, what I'm going to ask each of our panelists has been offered I think we said 5 to 7 minutes to give a brief overview of who you are, what position you play in your current role and relevant past roles, and some information. As Jean said, our whole mission is to sort of understand the use of evidence in policy decisions for children and families. And so what your experience has been, what types of decisions you're focused on in your current role where economic evidence would come into play. We have a speaker on the phone, is that correct? So, okay, so I'm going to start and we'll go down the line and then we'll finish up with Henry and Eric who are on the phone. So Uma, would you like to go first?
Good afternoon. For the record, my name is Ahluwalia. I'm the director of the Department of Health and Human Services for Montgomery County, Maryland. So what you'll get from me is the local government perspective. We're an integrated health and human services department. So I have everything from aging and disabilities, behavioral health, children, youth, and families, public health, and homelessness within my span. And as the recession hit, this question became more and more important, sort of how do we know that the money we're spending is most impactful, and what does the word impactful really mean? We started throwing words like greater efficiency, greater efficacy, and greater impact, and then to define each and every one of these words in a way that would then help us make decisions about which programs were we going to keep and which programs were we not going to keep anymore. And very, very tough question. In government, the budgets aren't set up in a way that inputs can happen for creating a framework where you can actually say, okay, here's the value that we're getting. So I did hear in Minnesota, they had done a little bit of work in Dakota County around prisoner reentry where they had built a calculator to develop a return on taxpayer investment. And so when the partnership funds came out through federal OMB, we actually applied through ACF, federal ACF through our state, to build a return on taxpayer investment calculator and a social return on investment calculator. And both of these are built and sitting in the public domain, but we built it on transition age youth and families who were homeless and single adults who were homeless. And that is now going to become the frame for us to look at pay for success, right? As more and more conversation in our sphere in health and human services is around talking around pay for success, it's very hard to do any kind of data modeling and cost modeling for pay for success if you don't have some degree of evidence that, and we just went into this huge exercise. We wanted to show that young moms under the age of 24 in the homeless system, children and youth, right, and families, that we could actually show that if we wrapped services around them, which would be a long-term effort, that we could get them to self-sufficiency and stability. And the data, we're not actually able at the moment to generate enough of the cost information to prove that. So from that standpoint, at the local level, making investment decisions, programmatic decisions, and policy decisions are handicapped actually without having good fiscal information to make those decisions. I will say that the question that policymakers always ask me when I'm sitting in front of them around budget time or at the state or at the local level, the question always is, why should we invest in this? Where's the evidence, programmatic and policy evidence, but also how do you know that it's getting you the results that you want, and ultimately, is it cost effective? And those are questions that if we want to continue to try to answer, we must have some framework for it. And I think the calculator does get us there, but the competency and the capacity is seriously lacking. So I'll stop there. Thank you.
That's great. Thank you. We're going to come back to that calculator actually and ask some more information about that going forward. Barry?
Thank you. I'm Barry Anderson. I'm currently the Deputy Director of the National Governors Association. But I have been in budgeting from one sense or another for over 40 years at a long alphabet of agencies, which I'll throw at you, GAO, OMB, CBO, IMF, OECD, and now NGA. In other words, I've had an opportunity to see budgeting from 4 different perspectives. Currently, the state perspective. Jennifer can talk about it better than I think I can because she's more tuned in with the people in the states, but also the national perspective, the international perspective, and my time at IMF was the supranational perspective. So I'm very, very much of a top-down guy, have virtually no background in children, youth, and families, but have quite some background in the use of economic evidence or a larger perspective performance in the budgeting world. In fact, when I got to IMF after 30 years in the U.S., one of my first assignments at IMF was to go to Brasilia, the capital of Brazil, and talk about performance budgeting and talk about the U.S. history of performance budgeting. And the U.S. history, if you know any of it, Gene and I were just talking about it, goes back almost 70 years to right after World War II with the Hoover Commission. And then more acronyms, ZBB, GIPRA, MBO, PART, the President's Private Sector Survey of Cost Control, which we used to call it OMB, the Grace Commission, and the, I can't even remember, Planning, Budgeting, and Performance or something of that nature. All of those, and all of those in my little talk in Brasilia, again, some time ago, I said, we're, from many countries' perspective, an absolute failure. Failure because the systems they set up did not overtake the political process. But to you and to this group, I would say I'm not too sure that they were a failure. Quite the contrary, I believe the purpose of economic evidence, stated as if there is something called economic evidence that we all know what it is and we're going to build it in. But the purpose of economic evidence is to be an input in the process. And the better we can make that input, the better off the outcomes will be. So that's my background.
Thank you.
Good afternoon. My name is Nadya Dabby, and I'm with the U.S. Department of Education. I oversee the Office of Innovation and Improvement, and I have a long title that tells you exactly where I sit in a hierarchy, but not much else besides that, so I tend not to use it in public gatherings. I'm going to talk just a little bit about how we think about kind of the evidence-based world from the federal standpoint, in particular in relationship to the education field. For us in the education world, thinking about how to build and use and generate evidence is a relatively new endeavor, although we think that started to change certainly over the last 10 years or so, and I think there's a ton of really good work that happens at the local level. So I want to emphasize that we very much think of our role at the federal level as to incentivize the people that are doing good work at the local level to kind of bubble that up, to help vet that, and then to help disseminate that, rather than say that sort of we are the ones with all of the solutions, but rather how do we help spur and grow the innovation that we see across the country in all kinds of interesting pockets. And just a little bit of context, whereas in fields like medicine, where there are thousands of randomized control trials and sort of a long history and a long infrastructure, really around thinking about what evidence looks like, what the standards for it should be, multiple mechanisms for disseminating it, for setting expectations about who uses it, where and when, under what circumstances and why. That kind of research and development infrastructure in the education world, it's much, much, much more nascent. And so some of you may be familiar with in kind of rapidly expanding sectors, we'll often see research and development expenditures hovering around 20%. In more sort of stable industries, that'll be in the low teens. In education, it's under 1% of what we spend on education is invested in the R&D infrastructure. And so we kind of have a long ways to go. The Institute of Education Sciences, which is the primary federal research and development arm, was developed about 10 years ago, and in those 10 years we've seen a few hundred randomized control trials that kind of come through there, but nowhere near what we see in other sectors. And we think there's lots of good work underway, and we're excited about where we are, but just want to say that we are kind of at the earlier end of this curve. For us, our evidence agenda is really about changing incentives in key areas in education that are often pretty sticky. So that's things like, how do we actually drive higher expectations for all of our students? And how do we make sure that students and teachers have the tools they need to be successful? How do we transform what's happening in our lowest performing schools so all students have a real shot? And then, of course, how do we overall build our knowledge about what's working and what can be improved in public education? The office that I represent is a relatively small portion of the federal department, so we make between $1 to $2 billion a year in grants. We are primarily a grant-making entity, and our job is really to develop, identify, and help scale promising innovations that tackle some of these persistent challenges. And we very much think of kind of that work as part of building this evidence pipeline and trying to change some of the incentives within the system to really encourage people to build that and use the evidence that does exist there. So I want to give one just quick example, and then I will use my time when we come back to talk about some of the lessons we've learned, because I think although we are new in this effort, we have still learned quite a bit and are pretty excited about what we're learning and trying to be transparent also about what that looks like. One of the programs that we run, I'll just mention quickly, is called the Investing in Innovation Fund, or I3. It's about a $1.2 billion fund so far, with about $200 million of private sector matching grants and about 150 different grantees. These grantees span a huge range of types of organizations, so longstanding institutions of higher education, brand new nonprofits, school districts, and lots of folks in between. We love that diversity. It's a relatively heterogeneous group, and that's part of what makes it so fun. And what we have done in that program in particular is to use evidence as an entrance requirement. So to say, in order to get more money, you have to have more evidence. And then if you are working in an area where there isn't a lot of evidence, that's okay. We want to encourage you to sort of still step into those areas where there are persistent challenges and we need folks to come up with new solutions. And then we're going to make sure that we give you the support and incentive to create evidence coming out of the program. So if you're taking on something brand new, like how do we turn around this very particular kind of low-performing school, you may not know exactly what that needs to look like. You're going to say, here are your goals, and then we're going to help you kind of build out your evaluation design so that you produce evidence that not only tells you whether what you did was useful, but that's really designed to be useful to the sector overall. So the notion here being that the public dollars need to have some benefit beyond the direct beneficiaries, and that we as an organization and as a field should be transparent and thoughtful about sharing that information and then using that for other people to build on and grow on, whether that's through our grant programs, through decisions that happen at the local level, or other grant programs that may sit within our sphere as well. And I'll give one quick example. I do think just as a field we are growing, and sometimes it helps to get your head around an example. We have, Stanford University runs an organization called CREDO, which I won't go into explaining the acronym because I'll probably get it wrong. But just recently, last week, came out with a study that evaluated the impact of charter schools, so public charter schools in urban areas, and looked at their impact on student learning. This kind of study 10 years ago is not something that popped up. This is sort of something that is now much more routinized in our world. And in that study, they found that urban charter students are getting the equivalent of 40 plus days in math, so that's 2 months of learning, and 28 plus days in reading compared to their peers in traditional public schools. And you will see in our budget request for FY16, we have a particular request that's geared towards actually putting more money towards those types of schools that are replicating that kind of success, just as a way to kind of give you a little window into how we're thinking about what it means for us to be doing encouraging evidence at the local level, but also thinking about how do we reflect that orientation at the federal level as well. I'm going to pause and turn things over to Dan.
Hi, I'm Dan Rosenbaum, and I'm a senior economist in the Economic Policy Division at the Office of Management and Budget, and also part of the evidence team at the Office of Management and Budget. So before I talk a little bit about what I do at OMB, I'm going to backtrack a little bit. I guess it's about 7 or 8 years ago, I was actually an economics professor for 10 years at the University of North Carolina at Greensboro. I think it gives me a somewhat useful lens on this, because at that point, obviously, I was more of a producer of evidence than a user of evidence. We didn't really have any important decisions we made at UNCG. And I also taught a lot of the applied econometrics courses too. So it helps me think a little bit about some of the methodology. Then I spent a year at the Council of Economic Advisors as a senior economist, which is kind of a funny little experiment they do with all these folks that have no idea what real policy works like, where they bring us to Washington, D.C. to spend a bunch of time in these meetings with a bunch of policy level folks. And so you get this very bird's eye view of kind of how these discussions go and what how evidence plays a role, and I think that's a useful perspective on this. And then I took a job. I actually gave up tenure to take a job at OMB, where I kind of have this dual role where I do this work as part of the Economic Policy Division and as part of the evidence team. In the Economic Policy Division, we work with lots of the agencies in different parts of OMB on lots of technical and empirical issues, and so I get to kind of see how evidence plays a role. Part of my role there, and then part of my role as part of the evidence team, I actually sit in on a lot of the high-level budget decision meetings that take place with all the different branches, of OMB, and get to see how evidence plays a role in a lot of those decisions as well. And then as part of the evidence team, we've had a kind of interesting progression over the last 7 years. I think our first, when the Obama administration started, I think our first inclination was, oh, well, what we just need to do is we need to produce a whole bunch of better evaluations. And so we had this kind of initiative to create more evaluations. And then we learned that that's not really the only problem, or necessarily even the most serious problem. And because there's lots of agencies that don't have much capacity to do evaluation, there's maybe better ways of thinking about how they could use that evidence. And so now we have an approach I think that's much more multifaceted. That's kind of focused on probably 4 different prongs. One's trying to make better use of the administrative data that all the agencies produce and could be used for evaluations and other evidence building. Helping grant programs become more evidence-based. It's kind of like the I3 program that Nadya talked about. Building evaluation and evidence capacity at agencies. So that some of that is things like the Chief Evaluation Office at DOL, or things like building kind of what works clearinghouse processes in various agencies. And then there's encouraging specific evaluation projects and thinking more broadly than always these being projects aimed at figuring out whether a program works or not. That sometimes these also could be kind of rapid, evaluations of things that just answer simpler questions like, could I set could I send out an outreach letter that's more effective, or do something else that helps improve a program, in various ways. So we'll probably talk a little bit more about some of the lessons learned from that and some of the other questions. In terms of other parts of my biography, I also have this second job that I do as a Moneyball data analytics consultant for the Cleveland Cavaliers for 7 years, and now for the Atlanta Hawks for the last 3 years. And that obviously gives me a very interesting perspective on non-experts using kind of empirical evidence in their decision making. And and I've learned a lot about the process it takes to get folks who aren't naturally researchers to think about how they're going to use that information. And it's building relationships, it's building trust. It's not a kind of one shot thing. And I think that it's a lens that I think I try to bring to my work at OMB as well. And then I guess the last thing was I was also part of the previous committee that was working on this, that helped produce the book considering applications and benefit cost analysis. So I've been thinking about this with the National Academies and IOM for quite a while.
Great, thanks. And then we'll go to our last speaker. Henry and Eric, are you there on the phone?
Hi, we're here. Thank you for including us. This is Henry Sobanet. I'm the director of the budget office in Colorado, and we've kind of jumped into this issue area in the context of our strategic planning and process improvement initiatives here in Colorado. As many in the room know, there's been a lot of efforts around this over a long period of time. Barry spoke well about all the different acronyms that have been out there. And where we are now is learning about, return on investment. I think in your second section, you'll hear from the people who are doing a project called Results First. But we are also trying to teach people how to really think about things that they influence versus things that they control. That's kind of an issue with public policy. The prison system, for example, how much do they control recidivism if there's no programming in the system and all of it either happens after they leave or something like that? So who's really influencing and who's really controlling? Another set of concepts that we've stumbled upon is lead versus lag measurements. We've read as an administration, the senior managers have read this book called The 4 Disciplines of Execution. And the concept there is leading indicators versus lagging indicators. So say, for example, we want to reduce childhood obesity, and we assess where we are once a year, but we don't assess along the way what are we doing about better menus in schools, teaching people about nutrition. all the different inputs that might lead to a change in behavior, those would be the leading indicators as opposed to the lagging at the very end, just putting people on the scale literally, and then wondering what went wrong. Rather, measuring along the way, do you have a chance of hitting your target? Now, what's interesting about that is you're trying to get a relationship between the lead measure and its impact on moving the needle down the line. And so we are trying to learn about program design, administrative structures, where people have failed or where they're being successful. And I think that it's an exciting time, I think, in public policy, because I think these databases are growing. The focus is getting quite sharp just because of fiscal constraints. And so I think what we're trying to do is really put this attention on new budget requests, and then slowly take a look at base budget requests, because I think everyone probably realizes that over time these different programs have been started and that they're very hard to dismantle. They obviously weren't started with bad ideas in mind, but assessing where they are now and then making changes has a set of operational or political or both constraints that makes it hard to make a change. So that's very much an incremental process. I'll turn it over to Erick, our Deputy Director here.
Hi, Erick Scheminske with, again, Office of State Planning and Budgeting here in Denver. I think that the one interesting thing that's to me worth discussing a little bit is, and I think a lot of others have already mentioned this, so I don't want to belabor the point. I'm sure there'll be an opportunity to discuss it as questions come up. But our office tends to spend a lot of time, and over the last 20 years has spent a lot of time analyzing new requests for information based on available evidence-based data that's out there. And from a decision-making perspective, I think the challenge for our government, for governments in general, is the reliability of the evidence-based data that's available to us, and then how do you take that information and build it into new processes, new programs that maintain some sort of ongoing fidelity to the ideas that have been brought in front of us. So I'll be curious to participate in this conversation and learn a little bit other people's perspectives, not only on how you use evidence to make decisions at the front end, but then also use evidence to make sure that as we continue to build our programs, we're maintaining fidelity to the ideas that we initially approved, and follow it through the process to make sure that we're continuing to do the right thing for the citizens that we serve.
This is Henry. I'll jump back in. One last point. I think one thing in this space that's becoming more important to learn about and get the language just right with policymakers and decision makers and legislators or chief executives is the difference between saving money and costs avoided. One of the earlier speakers mentioned pay for success, and that's one of the real hurdles to move to these more sophisticated and newer ideas. When you're actually saving a hard dollar, or is just in the future you won't spend a dollar, and assigning a real value to that and convincing people that an ounce of prevention is worth a pound of cure.